So, time for the guru then. For the next half an hour, you have the opportunity to talk to Dr. Dr Venkat, who is a fertility expert. This is all free, so this is incredible access to one of the leading, if not the leading, fertility expert in the UK, someone who is here to answer your questions. So if you are worried about fertility, maybe you've got a question about IVF or any other options that you want to explore, well, you need to pick up your phone and get in touch with me and Dr. Dr Venkat right now. The number to ring, 03459 440 445. You can also text 81869. You can WhatsApp 07920 500 200. And of course, email as well, thebigdebate@bbc.co.uk. I know that whenever it comes to these issues like fertility, like IVF, like problems or issues with conceiving, people get embarrassed. So if you don't want to give us your name, that's absolutely fine. You can remain anonymous. But the most important thing for you to do, if you do have a question, is pick up the phone and get in touch with us. Dr. Venkat, how are you doing?
I'm very well, Qasa. It's nice to be back on the show.
Yeah, it's good to hear your voice as well. It's been so long since I've seen you, actually. I can't even remember. Definitely at least a year. But what are the rules regarding your place and private clinics that offer similar sorts of advice and treatments like yourselves? What are the rules around that in this lockdown?
Yes, so our regulator has given us permission to continue to offer the treatment to the couples who need the fertility treatment. And previously, I remember the last year when we had the first lockdown, we were asked to shut the clinic down and complete the treatment and finish the treatments and start no new treatments. But during the second lockdown and the current lockdown, they have informed us that we can keep the clinic open and continue the treatments for the patients, because the patients are all getting restless and becoming more anxious that they are not able to have the treatment. However, we have to have proper protocols in place to protect the staff as well as the patients from the COVID-19 infection. That is the situation, Qasa, with all the private clinics and other clinics which offer fertility treatments.
That's really good to know that they are now open, unlike in the previous lockdown. Interestingly, sorry, one more question on this. By the way, anyone who wants to get involved, drop me a text, 81869, if you've got a question for Dr. Dr Venkat. But do you see that changing at all? I mean, we've been hearing about news that potentially tighter lockdown rules are going to come in place, people wondering whether nurseries should close and that sort of thing. Do you see yourself and others closing like back in March, or do you see yourself staying open?
Well, we haven't heard from the regulator to say that we should close, but if we are able to take proper precautions, like we test all the patients before they have treatment, so that we're not bringing anybody with infection to the clinic to pose infection to the other patients and on the staff. And similarly, we are testing all the staff at regular intervals so that we protect the patients from our staff as well. And for the staff, we use PPE when we do operations or when it come into close contact with the patients. So we protect both sides from this, and we have protocols in place. And we also scatter the appointments so that there is not a big crowd waiting in the waiting room, which is a big risk. And we do consultations remotely so that the number of people coming to the clinic is reduced in general.
Thank you, Geeta. Yeah, as always, good practical advice from yourself, and hopefully you'll be able to give that sort of advice to people, to couples who are in a bit of difficulty right now, as well as we come up to 12:15.
Absolutely, Qasa. That's a pleasure to share my knowledge and give advice to the people who are struggling out there and who are all very anxious and nervous. I know that because I see the patients every day who want to get on with this and have a baby as soon as possible.
Exactly. So yeah, get in touch 03459 440 445 or text 81869 and let us know if you have as well. Right, one of the things that you say every single time, and I'm not even joking, you literally just tell people, just have a laugh, just relax, because stress is such a huge mood killer, but also a fertility killer as well, in effect. Given the fact that we're in lockdown again, and for a lot of people, they have stresses along their jobs, along lockdown, worry, anxiety, so much. I don't need to tell you about people's stresses. How is that going to be affecting people, do you think? And what have you seen from the people that you are actually speaking to regarding stress and fertility?
Yes, because people generally are anxious when they have this fertility issue. The couples, when they are trying for a baby, when it's not happening, they feel that it is a failure on their part and it is giving them a lot of stress. And there is like a stigma attached to it. They don't want to discuss it with anyone. But with this COVID-19, it is adding to the problem. It is making life so difficult and different. And that is why people are getting more stressed, and they are worried that the clinics will close down with this new lockdown, and they may not be able to continue the treatment or may not be able to start the treatment. That is their worry. I tell them, look, we are not going to close the clinic, but we will be able to offer the treatment. We will take all the precautions. However, some patients mention that, yes, there are problems, but during COVID-19, because of the lockdown measures, many of them are working from home, which gives them flexibility to attend the clinic and also have the treatment, because they don't have the routine stress of traveling and working there and talking to colleagues and other issues there. So the stress is there on one side from the COVID-19 and lockdown and other things. However, practically, many patients are finding it easier to come for the appointments and go through the treatment because they are all isolating, staying at home. There is not so much pressure of the time there. They can come for the appointments and have the treatment. And we have in-house counselors all the time available. We arrange complimentary counseling during their treatment, before their treatment, or after their treatment, by telephone or Zoom. It's all remote. And we also have acupuncturist who is willing to talk to them on the phone or on Zoom, give some tips to reduce the stress. So we have the support system going well, which will help the couples during this difficult time.
Really good. Thank you so much for that. Get your questions in then. 17 minutes past 12, 81869. You can remain anonymous. Also, you can give us a ring as well, 03459 440 445. So, a few messages for you then, a couple of questions. First one, I'd like to ask the doctor, I'm concerned with the COVID vaccines, whether it can affect my fertility. I'm 36. I haven't had kids as yet. I'm thinking very strongly about having my eggs frozen. Reluctant to take the COVID vaccine until I've had my eggs frozen. Please advise.
Yes. Now, there is a lot of controversy about this COVID vaccine, because originally, when we started the vaccine, we were advised to tell the couples that if you're going to try for a baby and you want to have the vaccine and don't try for 3 months. But now, because the virus is so common and it is multiplying so fast, the society, that is Royal College of Obstetricians and Gynecologists and British Fertility Society, they all say that it's important for people to have vaccination so that they don't catch the infection. However, they always mention that there is lack of data regarding safety of the virus, the safety of the vaccination, during pregnancy. Because if one is pregnant, should we give the vaccine or not, is the question. They say that it is There is no data about safety during pregnancy. However, I generally say avoid the vaccine during the first trimester. That is the first 3 months of pregnancy when the organs are formed for the baby. That is the time we have to be extremely careful. Once you pass the first trimester, you can have the vaccination because you got another 4 months to go, 4 or 5 months to go through, and it is safer to have the vaccination so that you won't catch the infection and your baby won't catch it. Therefore, you can do it in the second trimester, not in the first trimester.
Thank you so much. I mean, another question on a similar sort of topic that we're going to come to in a moment, actually. But Nazia has got in touch with the program and wants to ask you one-to-one some questions. Nazia's not her real name. We've changed it because people want to remain anonymous. And if you're listening and at home, you've got a question, you can also have your name changed and remain anonymous as well. So Nazia, afternoon, you okay?
Yes, thank you. And yourself?
Not too bad. So what's your question for Dr. Venkat?
Okay. About 18 years ago, I got sterilised. And then obviously a couple of years ago, I was post-menopause. And my husband, I've previously got 4 children from my previous marriage, and we were looking into whether, because my husband is 52 and he's never had children, and we were discussing it, see if there's any options available with regards to IVF, or is there anything?
Yes, Nazia, we have the option of doing IVF for you. But yes, because of this sterilization, you need to have IVF anyway. And can I ask your age?
I'm 45.
Okay, maybe then, you said that you are sort of menopausal. It is better to use donor eggs. That will give you a very good chance of success. With donor eggs, because we are using younger women's eggs, the chance of success with IVF is something like 50 to 60%, which is excellent. And we have done it for so many patients, and it is very successful. Because you have been sterilized and you are menopausal, it is not a problem at all. It will not reduce your success rate. And of course, we have to do a checkup for your husband, make sure his sperm is all right. Then there is no problem. You can come and see us. We are more than happy to help you with the treatment. We have done it for so many patients like yourself. It is not a problem at all, Nazia.
Okay, thank you so much.
You're welcome.
Okay, thank you.
Take care. Thank you.
Okay, thanks. Bye.
No problem. See, there you go. Nazia, it didn't hurt that much, did it, getting in touch with us? And Nazia got her question answered. No one knows her real identity. And Dr. Qasa Venkat was able to do what she does best, which is help people. You can be that person as well if you drop us a text 81869 or give me a ring 03459 440 445. What questions, a bit of advice, maybe it's just a bit of reassurance, whatever it is, get in touch. So got a couple more messages for you, Dr. Venkat. I'm just going to do one now before we go to a quick track, because it's on something we started to talk a little bit about earlier, which is vaccines. So this message says, I can't come on as I'm working from home, but can you ask the expert if the COVID vaccine can affect fertility in any way? Also, what's the risks to pregnant women? Now, we've covered the last bit, haven't we, about the pregnant women, but risks to fertility, is there anything there that's been seen or checked?
Well, this is a new vaccine. They haven't had time to check all these things, a long-term effect on fertility. And however, this is a killed vaccine. It's not a live vaccine, so it should not affect the eggs or the ovaries or the uterus. Generally, we say avoid, after having vaccination, avoid getting pregnant at least for 1 to 2 months, so that the system has developed the antibodies and the virus is not there, viral particles are not there in your body. There is no risk of infection. So that will be a safe time, and then you can get pregnant. So it does not affect your future fertility as far as we know, but nobody can guarantee this because we don't know the effect of the vaccine on the fertility yet, because people haven't done long-term research on this. This is a very new infection and this is a very new vaccine. That is the problem with this. But so far, nobody has said that there is any problem. That is the plus point here, saying because it's important for you to move around in the world, and the infection is so prevalent now, you have to protect yourself. So it's important to have the vaccination and avoid getting pregnant for a couple of months after the vaccination. Then it should be okay, and your future fertility hopefully will not be affected.
Thank you so much, Dr. Qasa Venkat. Right, 25 minutes past 12. Our expert is with us for another 15 minutes. If you have any fertility questions, 03459 440 445. You can also WhatsApp 07920 500 200. And as always, please, if you would like to remain anonymous, you absolutely can do so. Right now, though, here's Jazdami Mitika Kanwa. It's called Charka.
दिल पे घबरो नी तू अखियां च रख ले वसा के सोने दी जंजीरी वर्गा मुंडा रख ले सीने नाल के चरखा मेरा रंगला विच सोने दी मेखा चरखा मेरा रंगला विच सोने दी मेखा वे मैं तेनू याद करा जग चरखे वल वेखा शीशे आज देखे तेरा मुख वे वेख वेख मिट देना अखियां दी भुख वे अखियां दी भुख वे हो अखियां दी भुख वे सीने दे विच रड़कदियां ए सोने दियां मेखां सीने दे विच रड़कदियां ए चरखे दियां मेखां वे मैं तेनू विच सोने दिया मेखा चरखा मेरा रंगला विच सोने दिया मेखा वे मैं तेनू याद करा है चंद चरखे वाल वेखा विच सोने दिया मेखा चरखा मेरा रंगला विच सोने दिया मेखा वे मैं तेनू याद करा है चंद चरखे वाल वेखा
Charka there, here on The Big Debate, 12:28. My guest for the next 10 minutes is Dr. Qasa Venkat, fertility expert, here to answer your questions regarding IVF and any issues conceiving that you may have. You can remain anonymous. Get in touch with us. WhatsApp 07920 500 200 and let me know what your questions are. So, next question. This one's from Nisha. Says, I've had 2 miscarriages. I'm scared to get pregnant again. Plus, we've been trying for a year, had no luck. Are we good candidates for IVF? So much to go at here, Qasa. First of all, what words of comfort would you be able to give Nisha?
Yes, Nisha, I'm sorry to hear that you had 2 miscarriages. It is so painful and traumatic. A lot of people in general population don't understand. They think, oh, you had miscarriages. A lot of people, women have miscarriages. No, it is like you need to grieve and you lost your baby. You and your husband will have a lot of pain. I can understand your feelings. But there is always hope. I have had patients with 8 miscarriages and we have made babies for them. So there is still hope. Don't give up. And yes, IVF is an option. There are different options depending on each person's case. We have to look at the individual case and find out why you are miscarrying. And IVF gives you an option of testing the embryos, because some of the miscarriages are due to the chromosomal abnormality of the embryos. What I mean by that is like Down syndrome or Edward syndrome. So like everybody knows that Down syndrome has got an extra chromosome of number 21. Trisomy 21 is called Down syndrome, and that leads to abnormalities in the baby. And sometimes if the abnormalities are severe, it leads to miscarriages in early pregnancy. So chromosomal abnormality can be corrected by doing this embryo testing. What we do is we check all the embryos, and there are some embryos with chromosomal abnormalities which we don't use, and we choose the chromosomally normal embryo. These are called euploid embryos, and we put them back. That way the woman gets pregnant and ends up with a healthy pregnancy. It will reduce the risk of miscarriages very much. So like I said, we had a patient with 8 miscarriages. She came to us and we did that and she had a baby. Sometimes it may not be due to the embryo issue. It could be due to some other problem in your system, in your body, like the uterus, or your body may be rejecting the embryos. These are called immune issues. This is a controversial issue. A lot of people don't believe in that because there is no evidence base for this. However, we have found that women with autoimmune diseases or autoimmune diseases in the family have such immune issues and the body rejects the embryo. In these cases, if we offer the right treatment and correct the immune problem, then the woman is able to carry the baby to term and have a healthy baby. So in your case, yes, IVF may be an option, but it's important to see a specialist first and undergo all the tests and see where the problem is, and then there is hope. That's what I want to tell you. Look, don't sort of feel despondent and sit in a corner. There is treatment available nowadays for repeated miscarriages. Come and see us or see one of the fertility specialists, and there is help available. We also have counselors who can sort of support you during the difficult time.
Thank you so much. I'm sure Nisha, listening to that word, listening to you speak there, has been able to get at least some hope. Thank you. Right, 12:32. Reema's called in from Birmingham. Reema, how are you doing? Afternoon.
Fine, thank you.
What's your question for Dr. Venkat?
Just want to ask. I was going for IVF previously a couple of years ago, and then I fell pregnant and I had a miscarriage. My partner had a sperm test, which Birmingham Women's Hospital have asked for a sperm count report from them. I provided that. I've had a scan. I've had blood tests. They've said everything is fine, and they're happy with that, and they'll let me know when they can do a follow-up appointment. I'm still waiting for the follow-up appointment, which has been a couple of months now. I've got one coming in March. I just want to know what the process is and how quick they would start the IVF treatment, you think, after that.
Okay, I know you are anxious to start, but it depends. If it is NHS, I think they are having a lot of pressure due to the COVID-19 infection, so they need beds, and your fertility units are sort of not functioning to the full capacity. They probably only do consultations, not the full stream of treatment. But if it is private, you will be able to start the treatment straight away because there is no delay. All the private units are functioning. and they are able to offer the treatment. So once you go for consultation with these results, they will be able to plan your future treatment, saying how we can change it, what should be changed to make it better for you, because you have a plus point there. You got pregnant, and only thing, implantation took place. That is one step further than having a negative test. After that, of course, you didn't keep the pregnancy. That is the second stage. Therefore, we know that in your case, implantation can happen. But
no, I was naturally pregnant when I was going for the IVF last time.
Okay. So you got naturally pregnant. That also shows that the implantation happened even naturally, but the pregnancy did not continue, which is due to so many factors like I mentioned earlier. So you have done all the tests, and then they will say, look, what can we do to protect or make the outcome better when you go for IVF? We don't want you to have IVF and end up with another miscarriage. There is no difference then. That's why it's important to test the embryos to make sure you transfer or you have the chromosomally normal embryo put back. We call it the right embryo, so that you don't have problems like miscarriages. And if you have other issues like antibodies, natural killer cells, then you need additional supportive treatment so that your body doesn't reject the embryos or the fetus. That's why all these supportive measures are useful as well. So I'm sure they will be able to offer it, and you can check with them when they will open or when they are going to. If there is delay, you can always go to other clinics which are sort of functioning and able to offer you an appointment quicker, because you are getting frustrated, which adds to the stress. I can understand that, because when you want to have a baby, you have had a miscarriage, you are waiting and waiting, things are not happening. It is very frustrating. It adds to the stress. And we also offer counseling for such people before they start the treatment, so that they feel better and start with a positive mind. That's very important. So there is help available. Okay.
Okay, brilliant. Thank you so much.
Take care, Rima. Thank you.
Thanks a lot. Thank you. Thanks.
So, Dr. Venkat, Jyoti's got in touch saying, I'm considering IVF. Can you tell me what it would be like for me? I'm a wife. In terms of supplements, I hear it takes a toll, can be painful. Also, is there a standard fee, how it works? So thank you very much for that.
Jyoti, I know there is a general notion that IVF is painful and everybody is so scared of IVF. It is not in any way painful, I will have to say that, but I will say that it is stressful, and you have to be committed to that. It is like important for you. It is a project you are undertaking. You have to give your whole self for that. And only thing which is sort of not nice is you will be having hormone injections every day from the second day of your period. And it is like a diabetic injection, diabetic pen. It's done under the skin. It's a very fine needle. So it is not physically that painful. It is sort of mental pain. And there are people who are scared of needles and scared of injections. They can't tolerate all these things. But otherwise, physical pain is not there when you do these injections, but you might have some hormonal symptoms like tiredness and you start feeling very emotional when you do these injections. And we also say sometimes, you become irritable. So people around you should know that you are having these hormones. It may be because of this you are behaving like this. And once you will have regular scans during this period of injections, and once the follicles are ready, then you will be booked for egg collection procedure, which will be done under anesthesia. Everybody is scared that, look, they will take the eggs out and I'm going to feel the pain because the needle will go through it. Yes, the needle will go through your vagina, which will be done under scan guidance, but you will have anesthesia. It's not general anesthesia. It will be intravenous sedation. So you will be definitely asleep. You won't feel any pain. And it takes about 20 to 30 minutes to do the procedure. Once you finish, you will be awake. and you will be allowed to rest for an hour. You will be monitored, make sure that you are recovering well. Then you will be allowed to go home after that. On that day, of course, your husband will be producing the sample, which will be prepared, and your eggs will be prepared. Then they will mix the egg and the sperm in the laboratory, in the clinic. That is called fertilization. And next day, they will know how many eggs have fertilized, and they will grow the embryos. That is, once they are fertilized, these are called embryos. They will grow the embryos for 5 days. When they become advanced embryos, these are called blastocysts. At this stage, they will have something like 100 to 120 cells.
Okay.
Initially, when they start, it's 1 cell, and then they will have 120 cells. And then we put the embryo back in. If you have more embryos, we can freeze them for future use. So it is it takes about 2.5 weeks, but it is not a bad procedure. It's not very painful. People are generally scared of it. And if it is becoming too much, all the clinics have counselors. You can talk to the counselor, you can talk to the nurses. They will give you all the support, Jyoti. So there is help available. You can make use of that. And every clinic is trying to make the process as less stressful as possible for you. Okay?
Very, very comprehensive there. Thank you very much. Right, very quickly, last one. Someone who is in a consanguineous marriage, so basically similar background, come from generations back, I suppose. Will the vaccine cause a higher risk than normal of complications to a baby if we try to conceive?
Okay, that's a very good question, Qasa. Consanguineous marriage means marrying within a family.
With only 30 seconds left, what would you say here?
Yes, so that means there is the risk of having congenital abnormalities, but the vaccine does not increase the risk by itself, but the general risk of the vaccine is there. But in your case, there is no increased risk because of the vaccine. That's what I would like to say.
Thank you. As always, you've brightened up my afternoon, Geeta, and also helped out so many people. So thank you very much. As always, stay safe and chat to you soon. That's Dr. Qasa Venkat there. And this is